Hello everyone, I hope you guys are fine. And so this is my first video about the PLAB 2 series. So I've recently given my MSR exam and hopefully I'll get into the GP training this year. I've decided to make these videos about the PLAB 2 preparation so that you guys can get the things that I have learned very in a very concise and informative manner. You don't have to pay anything for the education. I believe in free education, so I've been preparing this. So I'll be preparing these videos one by one. Please do subscribe to my channel and keep me motivated to make such videos. The first thing I'm going to start for this PLAB 2 exam, which I think is very important, is about the communication skills. You know, most of the time in the PLAB 2 exam, the doctors who are giving the exams, they are more or less equal in matters of the clinical knowledge, and everybody who are preparing for the exam at the end of the day, they will diagnose and give the management, which will be same for everyone. The thing that will differentiate you from others, pass or fail, will matter by the communication skills, your interpersonal skills. That is the thing you must master to give this exam, as the competition are getting very tough. So the first thing that I'm going to talk about is verbal communication skills. So this is my note. I have different notes, so day by day I'll upload in the YouTube channel. Okay, so do share and subscribe my channel. So first thing is verbal communication skills. As I already told you, that is very important for PLAB 2 exam. So how do I express verbal or non-verbal communication skills? So the more important thing is obviously non-verbal communication skills, because the examiner will be right there at the side between you and the patient, looking at you, like what you are doing and how you are expressing yourself. So the first thing about the verbal examination is the tone of your voice should change depending on what you are talking about. So you can't be excited and smiling and happy when patient is talking about his grievance or his pain or sorrow. Similarly, you can't be very serious or like dead silence when he's becoming happy, or when he's commenting about something positive, like this said, oh doctor, yes, I have finally quit my smoking and I took your advice. So you have to like so some response to it. You can't be like okay, so like dull and stone face. You have to say, oh, I really comment on you that like you quit your smoking is a very good thing. Like you can say anything, like okay, but say something like in response to that behavior. Don't be like just silent guy with just trying to act like to show the examiner that you are going through the consultation. Okay, so just and of course your facial expression and body posture should also change to suit the circumstances. Yeah, you can. And by that what I mean is that you can, the body movement you can do, like nod a head, you know when patient is talking, like list of this, when they list the symptoms, like I have this, I have that, and you can just yeah. So basically what I use in the exam was, yeah, this sounds what which I just did without even realizing it, that okay, so yes, I understand. So these are the things I'm going to say whenever patient talks about. But like be very careful. If you're making this sound like a, a certain sound as your like repetitive words, then this will not sound good. You can't keep on saying okay, okay, okay after every words or every sentence the patient says. You should have some variety. Okay, okay, that's, I understand. I'm listening. Yeah, so you can say these words. And one of the very funny incident is that be careful, like you do not use the words that is positive or negative. Like so what during my preparation I had this habit of saying okay good, okay good. I used to say good, okay, So these are the words. And what happened was, during one of my mocks, the patient was like very sad, and he was talking about his family dispute and his sorrow, and he's fighting with his wife, and even scolded his child. And what I did was, okay, good, so I said this word, and the examiner and the actor suddenly got angry at me, said, what is good about it? So uh, I think I lost a couple of marks there. But you know what I did was, I turned it around. I said, sorry, I didn't mean to like offend you. It came out of my mouth suddenly. I'm sorry for that. I didn't mean to offend you. So, and he just said, he didn't like nag me on that. He just said, okay, okay, that's fine, and he just continued with that. But you know, like, I made that mistake. So I'm just saying, just do not make the words that you are going to say either positive or negative. So is neither a positive or negative. Okay, so okay is not a neither a negative or a positive. So so you can use, don't say good. Okay, so you can say, okay, so you are not going to say that it's a very bad sound, oh, you can say that like that. So it is a bad sound. So just say okay, I understand. These are the things you are going to say. Okay. And about the eye contact, I know that people are getting stressed over the exam, but please do not do not like shift your eyes to somewhere else. Try to maintain eye contact with the patient. It's a sign of confidence and respect for the patient. Okay, so one more thing. During physical examination of a patient, you need to ask the patient a question. You need to look at the patient face, meaning that you need to stop your examination momentarily. It's a matter of a second. Then continue after the patient has answered your question. Wait for patient to respond. So these are the small things that the examiner will look during your exam. Okay, so next point is, check if the patient knows what is going on. Okay, so just like in real life, it is very important to clarify with the patient how much like he or she knows about the condition. So if anyone has been here before yourself, to explain the things to them, right? You can do these things at the beginning of each consultation, so that you can determine the starting point. I'll talk about all these things, like how you're going to start in the upcoming videos, I'll talk like how you're going to start, how you're going to just the introduction section. So what are the varieties you need, so I'll be talking about in the next videos. But for now, just understand that you need to know what the patient is going on, what the patient is thinking, or so like it will be a better thing to start with example. So you can say something like, hello, are you Mrs. Kapoor? My name is Dr. Shrestha. I'm here to talk to you about your condition, and to explain how we'll be managing you further. So, and now here you can add those sentences to check the patient knows what is going on. Has anyone been here to explain what is going on with you? Or you can even say that, has anyone been here to explain the results of your investigations? So you can add these kind of things. So these things are the based on the cases what will be given outside the cubicle. Like there will be a scenario. So the patient is coming here for the test results or anything like that. You are not going to say these words for a new consultation or anything like that. Or you can even, sometimes the cubicle, the question will be like, someone is waiting at the ER to like for to know what is going on with her. So you can say in those moments that, because in the ER some doctors might have already seen the patient at the first instance, so you can say, has anyone been here to explain what is going on with you? So you can use this term, but you can't use this term for the new consultation. Okay, so be careful on that. So yes, and in the exam, always consider the possibility that the diagnosis or the investigations have not been explained to the patient. So just bear that in mind. If it has already been explained, then why would you be even in the giving the test, right? The cubicle is about you explaining things to them. Yeah, okay. So it is better to start explaining the investigations or diagnosis to the patient, and then be told that by the patient that they are already aware of the results or diagnosis, than to assume that the patient knows about it. So if you mess it up, it's better to explain the things rather than just assuming that they already know about these things. So the worst thing going to happen is they will say that, okay, so I already know about that, so they will not got the marks on that. You might lose some time, but at least it's a good thing. rather than just completely neglecting that they might already know and you don't explain anything. So yes. Yeah, yeah, okay. So the next thing is, before you start your consultation, you need to ask patient what they would like to know. So it is a, so yeah, so this is a I don't know, like this is depends on you, I think, because you know, for example, like you can say, so Mrs. Kapoor or Mrs. anything, Mr. Ram or anything, before we start, do you have anything on your mind that would like us to discuss? So this allows you you to know the patient expectation, you know. uh, so these are the things that I think it was written somewhere in my one of the institute, I don't know which, I forgot, but you know, I didn't used to follow this particular thing, that before you start your consultation you need to ask patient what they like to know. So basically they will come with some complaint, and what I used to do was, you know, this is a one of the list in the ICE. I'll tell about the ICE thing later on my videos. ICE means ideas, concern and expectations. So it is, I used to omit this expectation part. I used to gather ideas and concerns, but what I used to do was expectation. I used to always put this expectation in the last section of my history taking, you know. So in my point of view, I don't know, like, because most of the people say you have to ask at the beginning only, but what I used to do was, I used to explain all the things. So so that because because you know, till you are giving the exam you are practicing so many cases and you already know what is going on, and so you obviously know what you're going to do. So it is better to like ask at the last, so you will be explaining everything. And at the last I used to say that, okay, so whatever we discussed today, was there anything different than what you expected? So this was the thing, the this was the sentence I used to use, you know. So I think this is the much safer way to approach this thing, like by talking about the expectation at the last of the thing. So whatever we discussed today, whatever I have given the suggestion, or whatever about the diagnosis or the symptoms or management, is there anything different than what you expected? So yes. So, and why this is important, that sometimes you know, even in the real practice you do everything, and sometimes they come with this you know, tennis elbow, and you know the x-ray is not even needed for that because there's no any history of trauma or anything. So you'll explain the patient about this tennis elbow, you'll talk about the management plan, the physio, and possible need of corticosteroid injection. But you know what the patient actually wanted? Even this happens even in the real life cases, like they want the x-ray of their hand just to be sure. And when you ask these questions like, and did you expect anything from this consultation, they might say, yeah, I was wishing to get an x-ray of my elbow or my hand. And at that time you have to like intervene. Okay, so you have to make them understand like why x-ray was not needed, or why x-ray is needed, or you, like if they are not satisfied, then whether you want to continue with the x-ray or not. So yeah, so this is the example of like about asking why you need to ask this expectation thing. Okay. Yeah, so moving on, the video is already going to be long, so I just want to go quick, just the important things. So initial approach or introduction. So how will start this like, okay, so I just give me some second, I'll check. So I talk about the check the patient what is going on before you start your okay, so I talked about the expectation. Now initial approach or introduction, so how you're going to start it. So yeah, this is very basic. So whenever you you start your introduction, just make sure that you match following things in your mind, like, do you introduce yourself clearly and explain your role within the team? You know what, and what is that, what does it mean is that like, so I am Dr. Shrestha, you have introduced yourself, like, and what is your role today? So I'm one of the junior doctors in the GP surgery or emergency department. So your role is as a junior doctor, and I'm here today. So what is my role is, I'm here today to talk to you through your complaints or through your symptoms, or to help you. So you have to also explain your role. Okay. So do we explain the purpose of the interview? Yeah. So I already said I'm here to like talk about the test results. I'm here to talk so that I can help you with your symptoms, or I can help you anything like, yeah, yes. So you have to explain the purpose of the interview. So do you consider patient safety issues, including checking the patient's identity? So always make sure that you are talking to the right patient. So there are many things. I'll talk about these things later. So just make sure that you are checking the patient's identity. Are you polite or not, and professional with the patient, treating them with sensitivity and respect? So the next point is, do you check the starting point, that is finding out how much the patient knows what is going on. Already I have talked about this, so whenever you introduce yourself, it is best to, in the UK it is best to introduce yourself by your surname rather than your first name. It's quite different from the abroad. From especially IMG doctors, they have the habit of introducing yourself by their first name, but you are using your surname, like Shrestha. I'm Dr. Shrestha. I'm Dr. I don't know, like Kapoor, anything like that. Yeah. So yeah. And yeah, and talking about the identity of the patient, you can either do that by calling their name or by asking them how they would like to be addressed. So this is the best thing to do. Like, don't take the risk of directly saying Mr. Sarah, Mr. James, Mrs. Sarah, Mr. James. Just ask, okay, so how would you like me to call you? Or you can say, how would you like me to address you? This is a very simple words that you can say. And it is expected that someone has told you how he or she would like to be addressed, you stick to that name. This is very, very important. I've also worked as a mock examiner during my stay in the UK, and I have seen multiple times the candidates, what they do is, okay, so they have already a habit of like being fit into this format, like they already, okay, so how would you like me to address you? And if I say, okay, I want to, okay, so you can call me, suppose you can call me Cruz, if I say that. So outside the cubicle my name will be Cruz, Cruz James, and I don't know why they'll keep on saying James for the rest of the consultation, where I have clearly said I would like to be called as a Cruz. So if you ask that question, and this is what it means to be like listening to the patient. You have asked me to what do I like to be called, and you are calling me by other name. So it's a blunder thing to do. So yeah, so if you ask this question and just like be attentive, the person might say different things, like what you like to be called. So you can just call me Mrs. Smith, or you can just call me Smith. So you are not making mistake of telling the patient that, okay, Mrs. Smith, if he has already uh, mentioned that he or she just like to be called as Smith, then throughout the consultation make the habit of saying that Smith. Do not include Mrs. Smith, right? So I think you guys got the point. Yeah. So next point is checking for patient understanding. So yeah, you need to stop from time to time to allow the patient to ask questions and to check that the patient is following the explanation. You are not going to just throw the bunch of information and the patient is just not interacting with you. This is also not a good sign. So when you talk about you're explaining management, explaining diagnosis, then just in the middle, just after the few 3 or more sentences, you can say, have I made myself clear? Is there anything you would like me to like to ask me, or are you following me? You can use these words, okay, just to mix it, and they will say, yes, yes, doctor, I'm listening. And that is a very good point in the eyes of the examiner, that you are not just trying to throw the information, you are also checking whether the patient understands or patient is following you or not. Or you can say, am I clear, or am I too fast going on this information? And patient will either smile, no doctor, is absolutely fine, you're doing absolute job, or something like that. Yeah, they might say that. Okay, so do you speak at a pace and detail which the patient can follow? Yeah, this is very important. So even myself, I used to speak a very, very, very fast, like my pace is very, very fast, and the time pressure, and you want to complete the case as soon as possible. Don't do that. Just think it as a real scenario. Take your time, utilize your 8 and 10 minutes, whatever you get, and try to be in a normal pace. Don't like be a very fast. You're not going to do that. Okay, don't rush the things. Yeah, so okay, and the next point is explaining and advising. You need to speak at a pace which is comfortable for the patient to follow. Refrain from using jargon and medical terms. If you use phrase, the medical terms are only used when you are describing something to the examiner. Like there will be some cases like find diagnosis and discuss the management plan with the examiner. At that time you can use medical terms, but with the patient, it is good to stick to the layman terms. Okay, if you use phrases which your body language does not support or express, you'll lose marks. Remember that. Yeah, and you should also be able to show doctor-patient interaction. Most of the time, examiners are looking for real interaction between you and the simulated patient, not memorized phrases, which I've already told you. Okay, just don't sound too repetitive and don't use so like. Even if you use the phrases, put a tone to it so that you can make that phrases your own. Right? You're not saying you're not. Don't just say the words or phrases for the sake of saying. I actually try to mean it. Yeah. So yeah, you can demonstrate that you are practicing passive center medicine. How can you do that is that when explaining treatment to the patient, you need to offer the available options as well. Give the advantages and disadvantages of the treatment, different treatment options, and advise the patient on which method you would recommend and why. Yeah, so do not impose treatment on a patient even if you feel that this is the best treatment available. Rather, give the patient information about the available treatment options. That includes advantages and disadvantages, but let them decide upon suitable treatment for themselves. You can say, for example, Mr. Smith, from what you are telling me, most likely you have a condition called heart failure. So heart failure is a condition in which your heart is not functioning properly. Have I made myself clear? Is there anything you would like to ask? You can say these words. Okay. And regarding the management option, what we can do is it would be better for you to stay in the hospital so that we can keep a close eye on you. Would that be a problem? We'll then do some further investigations like blood tests and scan of your heart. We'll also start you on a water tablets, which means diuretics, which will help the excess fluid in your body, which is causing swelling of your legs. So how do you feel about that? So this is a very good sentence we can use. Now sometimes you have to answer very difficult questions, so it's very important not to give false reassurance to the patient. So some of the examples are like after an operation, most of the time you see a patient asking, when can I go home, or where did I get this infection, will you cure this infection? So this type of questions can be answered in a similar manner. It's a difficult question to answer, and there is no harm in admitting to the patient that you do not have an exact answer to the questions. Don't be afraid to say I do not know. Okay, but it is a way of saying it. I'll talk about that. So as a junior doctor, it is also important to know when to say it is difficult question to answer, the according to your roles. There's a term, I just forgot about that. What it is called, while applying jobs, there's one section that mentions these things like know your competence, or I don't know, like I just forgot about this, just forget it. So it is difficult to answer those questions. So you should only tell the patient it's a difficult question to answer if you feel that even after consulting your seniors, they will not be able to give the exact answer either. So like, okay, so when can I go home? It's a very difficult question for someone which has infection of the MRSA wound infection. It is definitely a difficult question to answer because determining how long it takes to clear the MRSA infection would be difficult even for seniors. They may just offer you an estimate. Okay, so it is also important to know that the scenarios are set at the level of foundation year 2, so you should be able to answer most of the questions. You cannot keep saying I'll consult my senior. Yeah, okay, the examiner would like to hear your advice and management plan. So if you say you will consult your seniors, you will not gain any marks and you risk failing the station. The best approach would be to explain your likely management plan to the patient at the end and you can simply say, I'll also consult my senior for a second opinion. This is the best thing you can do. Just whatever you think is right, just explain to the patient. So okay, so based on your this MRSA order, so multi-resistant staphylococcus aureus, sorry, methicillin resistant staphylococcus aureus. You can say that, so based on the wound infections and the way the wound heals, it might take longer than what we imagine. So I can't say the exact number of the days, but you might need we might have to check your own time and again and decide how it is going on. It might be prolonged or it might be shortened. However, I will consult my senior for a second opinion to give you the exact answer about it. So is that all right? You can say these things. Okay, yeah. So I think video is quite long for today. Now next time I'll be talking about the history taking skills. So this is very important topic. So these are just today is just the introduction and just the overall approach kind of thing, and next time I'll be talking about the history taking. So how do you introduce yourself, what are the different ways that you have to introduce in the different scenarios. So I'll be talking about all these things. So do subscribe and share among your friends. So whatever I provide in this in the upcoming videos will be absolutely free for you guys in the YouTube channel, and I will try to make it easier for you guys to pass the exam. So these are some tips. Okay, so don't be disheartened by such a small slide that I shared today. In the upcoming slides it will be more, and you might you don't want to miss those things. So as soon as I get free times, I'll be recording the videos and post it on the YouTube. So good luck guys on your preparation, step by step. I'm sure that you'll clear the exams and have a better life in the UK. Okay, so see you. Bye.